in China. Surveillance. We have the general centralized data center. It's in China CDC. I will know within hours whether or not we have an outbreak, even in a small village.
By 2019, Gao was promising that the country's new online surveillance system would be able to prevent another outbreak like SARS.
So they were indeed confident, right, that they had the capacity to handle a major disease outbreak. Should it happen, right, that they would be able to nip the crisis in the bud.
On the 1st of December 2019, a man in his 70s fell ill. He was admitted to a hospital in Wuhan, a vast industrial city and the transport hub of central China. Unbeknownst to anyone at the time, within days, up to 200 people were likely already infected with the coronavirus. They were walking around undetected, most likely with mild symptoms of Many of the cases would be traced to a sprawling live animal market which supplied the city's restaurants and food shops.
Colleagues at the Wuhan CDC, the Wuhan Center for Disease Control, 2014, took me there really to say, look at this place. This is the kind of place where emerging microbes may appear. And I took lots of photographs because they are quite jarring. There were snakes, cats, raccoon dog, and they were sometimes in individual cages on the floor and sometimes stacked on top of each other.
After SARS, Beijing had passed a law requiring markets to maintain sanitary standards, but it was widely ignored.
People will kill animals in front of you. There's feces, guts, blood, organs lying around with wild birds coming down and feeding on it. You've got thousands of people congregating. It's a really good place for a virus to spread from one person to another and get out into the community.
It's not known whether the market was where the virus first made the leap from animals to humans. But by mid-December, several people were turning up at nearby hospitals. Doctors noticed a pattern, strange white spots in patients' lung scans.
Doctors put two and two together that if you're in a hospital you see one pneumonia patient or even two, you may not think anything untoward's happening. But the fact that they were seen in different locations meant that that cluster meant there was an infectious agent going around.
After the first illnesses emerged, doctors at Wuhan Central Hospital took a sample from a patient's lungs. They sent it to Vision Medicals, a private company more than 500 miles away. Within 48 hours, the company had come up with a short genetic sequence of the virus. A technician at the lab later posted an online account of what happened next. Virologist Wang Linfa read the post before it was removed from the internet.
The report back on December 26 is to say, oh my God, these patients samples contain genetic sequence most related to that coronavirus.
The technician then privately told his boss about the coronavirus over the messaging app WeChat. Coronaviruses are a large family of viruses which includes SARS and the common cold. The sequence from Wuhan hadn't been seen before, but it was strikingly similar to SARS.
The person who operated that machine and did the analysis basically sent a red light flash to the boss of the company. And the boss says, this is serious. Don't send the report out until you're 100% sure. And a few hours later, basically says, I'm 100% sure. This is real.
The lab informed the doctors at the hospital and the Wuhan CDC. They also sent the sequence results to the state-run Chinese Academy of Medical Sciences in Beijing. Over the coming days, word of a new SARS-like virus was starting to spread among officials in Wuhan and Beijing. Several more samples were sent to other labs for sequencing. None of these results were initially shared with the international community.
So the sequence of a pathogen is really important because that is what allows people to figure out how quickly the pathogen is spreading and to be able to create tests to detect the virus is really crucial information for health authorities in other countries to start detecting this virus. You know, where is it going? Is it going to go outside of China? Is it going to become a pandemic? Is it human-to-human transmissible? Of course, you don't want to rush out some information that could potentially be false and, you know, make everyone think that, oh, this is some other kind of pathogen and somehow misinform people.
Almost a month after the first cases emerged, hospitals in Wuhan were receiving dozens of patients with severe pneumonia. Wuhan's 11 million people were still going about their lives as normal, unwittingly spreading the virus around the city and to the rest of China. Then a lab in Beijing that had been reviewing a sample of the virus sent Wuhan Central Hospital some startling results. This lab had gotten a different result from the previous one. Rather than a virus similar to SARS, they said it was SARS itself. It would turn out the lab had made a mistake, but the results quickly started circulating among doctors at Wuhan Central Hospital.
This was the first time that the information about the possibility of this virus was shared. This was the first time there was documentation, there was evidence that something is really happening, and that's being shared publicly. WeChat groups are like little discussion circles. It would be hundreds of people in one group. And it's very, very easy for information to spread, and it spreads like fire.
At around 5:30 p.m., it reached Li Wenliang, an eye doctor. He forwarded it on with a warning. Don't circulate this information outside the group. Tell your family and loved ones to take precautions.
He was talking to a group of fellow doctors from his university when he brought up the problem. He wasn't trying to go public. And in the ordinary course of events, it would have been like a little black mark on a record somewhere. Instead, he ended up at this kind of crux of history.
His message went viral. In Wuhan, the local health commission ordered the city's hospitals to report any new cases directly to them. and barred them from releasing information to the public. Within 12 minutes, the orders were leaked. They, too, were widely shared on the internet. News of an outbreak had escaped.
I guess you could say it's the most wonderful and busiest time of year. A lot of people, high volume, are going to be traveling. They estimating 40.
That night, the rumors reached Marjorie Pollock, an epidemiologist with ProMed, an organization which sends out alerts on disease outbreaks.
I checked my email after dinner, and I had an email from a colleague in Taiwan. Social media was ripe with lots of chatter going on in Chinese of an outbreak, and did we know anything about it? I was able to monitor the Weibo posts, and it was just going wild. My reaction was, we're in trouble. It was very much a deja vu of what happened with SARS-1. So put together a report to go out as what we would call an emergency post, getting it out as soon as possible.
It went out to around 80,000 subscribers worldwide.
It's already the new year in much of the world, and here in New York, they're getting ready for the most famous New Year's spectacle, the ball drop in Times Square.
Peter Daszak, head of a New York-based infectious disease research organization, contacted Marjorie Pollock with more news.
I got hold of her on New Year's Eve, and as the champagne was getting warm, we realized something really serious was going on in China. We had it from a good source that this was a coronavirus and that it was 20% different to SARS. So we knew that SARS was pretty good at transmitting from person to person. We knew it had a 10% mortality rate. That's a huge red flag. And really knew something was wrong when every single senior person that I was trying to get hold of in China was busy. I sent a really long text to George Gowes, head of the CDC. I offered to send a team out there to come out there and do anything to support him, and I got the shortest response ever from George, which was Happy New Year.
But George Gow did contact virologist Ian Lipkin with information about the virus. This is the first time Lipkin has publicly recounted details of their conversation.
I was in a restaurant waiting to ring in the new year, and I got a call on WeChat, and it was George Gow. He'd identified the virus, it was a new coronavirus, and that it was not highly transmissible. Well, this didn't really resonate with me because I'd heard about many, many people who'd been infected. I think he was just wrong. You know, I don't think he was duplicitous. I think he was just wrong. He should have released some sequences and said, this is what we know. These are the sequences we have. My view is that you get it out. That's the way we do it, because this is too important to hesitate.
George Gao did not respond to our interview requests. He has told Chinese state media that the sequences were released as quickly as possible, and that he never told the public there was no human-to-human transmission.
News of the possible outbreak had actually spread far beyond Wuhan by late December. And that suddenly there was this increasing kind of pressure because the outside world was looking. But that's a dual-edged sword in China. Because on the one hand, the outside world looking can create pressure to act. The outside world looking can also create pressure to cover up.
Viral pneumonia has hit central China's Wuhan city. Authorities have reported 27 cases in total, 7 of which are critical.
The National Health Commission now instructed Wuhan health officials to announce the outbreak. The news was aired on state-run TV.
Patients are reported to have worked at a local seafood market.
But the officials played it down, describing it only as a viral pneumonia that was under control. They reassured the public that there was no evidence of human-to-human transmission and closed the market where they maintained many cases had originated.
The first instinct of the authorities is always to cover up. One of the key values of the Chinese Communist Party for the last 40-odd years has been stability. The avoidance of what they see as chaos, the dangers of revolution, overthrow. But the party is also very concerned about the idea that whole populations might freak out. And that might result in mass shortages or people being crushed to death trying to flee somewhere. That urge to control, that belief that the public can't be trusted, is also very kind of ingrained.
The definition of stability keeps getting escalated as the ability of the Chinese government to monitor absolutely everything improves. Even some of the thoughts and speeches of Chinese citizens, they are now seen as signs of instability. Increasingly, even in WeChat, which is a private platform, that kind of so-called deviant speech would be punished with administrative detention or suspension of accounts.
武汉市公安局官方微博发布消息称，关于当前武汉市肺炎疫情。
On January 1st, the Wuhan police dealt with the doctors who'd spread the news of an outbreak. On state TV, they were labeled rumor mongers and internet users. Several were given official reprimands by the police. The news was widely covered on national television. The eye doctor Li Wenliang, whose post had gone viral, was called to a police station where he signed a confession. The Chinese government has disputed that what happened to Li is evidence they were trying to suppress news of the outbreak. They say he was simply being urged not to spread unconfirmed information, and that all countries have strict rules on the confirmation of infectious diseases. But the clampdown extended beyond doctors. Chinese journalists were now subject to specific censorship instructions, and key words began to disappear from the internet.
When I first started seeing the reports on December 31st, doctors from inside were describing it as SARS. And so I started searching Wuhan SARS to see what the discussion was online. And I couldn't find anything. You had that standard term, that relevant search terms blocked, which is not a surprise because the government obviously wants to keep things stable. I'm pretty sure they did not want any comparison to SARS. They wouldn't want a panic to ensue because of that.
But by now in Beijing and Wuhan, top government officials were confronting evidence that they were dealing with something potentially serious, a novel coronavirus.
So let me tell you what international law requires. If the government knows about a novel infection that meets the criteria within the international health regulations, and a novel coronavirus, by definition, meets those criteria of a potential public health emergency of international concern, the government is obliged by law to report that to the World Health Organization within 24 hours. So it was reportable. The failure to report clearly was a violation of the international health regulations.
The World Health Organization first learned about the outbreak not from the Chinese government, but from social media and a ProMed post. On January 1st, its incident management team began a series of emergency conference calls.
I remember sitting on the floor in the living room of my sister's house at 3 o'clock in the morning on those calls with the aim of, really understanding the situation. We had the assumption initially that this may be something new, that it may be a new coronavirus. And as a respiratory pathogen, for us, it wasn't a matter of if, human-to-human transmission was happening. It was, what is the extent of it, and where is that happening?
WHO officials requested more information from China's National Health Commission. It was 2 days before they heard back. What they were told was vague. There were 44 cases of viral pneumonia of unknown cause.
The country has an obligation to answer WHO's questions honestly, fully, and transparently. And I don't think that happened entirely. Anytime you get an emerging disease outbreak, it's a little bit of chaos at the beginning, and also a little bit of disbelief. But having said that, it's hard knowing what happened at SARS, why the WHO was not informed straight away. Once you report to WHO, it's open to the world. You start to get travel and trade restrictions placed upon you. China had the memory that they lost a lot of economic productivity in travel and tourism and trade during SARS. And so I think China's view was that it wanted to handle this pretty much, and that it was going to, it didn't want outside interference.
The Chinese government refused multiple interview requests. Instead, it shared a document called Reality Check of U.S. Allegations Against China on COVID-19. The document states, "We have all along been in good communication and cooperation with the WHO, and China has provided timely information to the world in an open, transparent, and responsible manner." The National Health Commission now had a team of scientists and officials on the ground in Wuhan, investigating the outbreak. Labs across the country were secretly racing to map the complete genetic sequence of the new virus. One of those labs was run by a renowned virologist in Shanghai, Professor Zhang Yongzhen.
Professor Zhang, he's a very friendly, passionate, extraordinarily hard-working scientist. I've been working with him since 2012, and we've essentially used genomic technology to try to understand virus evolution and diversity. Just how many viruses are there? How big is the total universe of viruses, the virus there?
Virologist Eddie Holmes and Professor Zhang were in the middle of a long-term project on respiratory diseases at Wuhan Central Hospital when the outbreak began. On the 2nd of January, lung samples from infected Wuhan patients were sent by high-speed train to Zhang's lab. At around 2 a.m. on the 5th of January, a breakthrough. Zhang had obtained the full genetic sequence of the virus.
I was driving to breakfast, and he called me on the car phone. His team had worked very hard, and so he was very proud, obviously, of the work they put in. On that very day, he was working to try and get information released as soon as possible, so the rest of the world could see what it was, and so that we could get diagnostics going.
It was important confirmation that the virus was very similar to SARS, and therefore likely transmissible between humans. Zhang's office immediately wrote to the National Health Commission, advising preventative measures in public places. Zhang and Holmes wanted to make the sequence public right away, but they couldn't.
There was an official memorandum that had gone through saying that we were not allowed to do this, and so he was put in quite a difficult position.
2 days earlier, the National Health Commission had sent out secret instructions to laboratories, forbidding them from publishing their results without authorization, and requiring them to destroy or hand over their samples. The Health Commission's orders were later leaked. 4 other Chinese labs also obtained the full genetic sequence of the virus. They, too, were forced to sit on their findings.
I mean, the notice says very clearly that you cannot spread or disseminate any information about this pathogen to the outside world. And what that effectively did was it silenced individual scientists and laboratories from talking about this outbreak, from revealing information about this virus, and potentially allowing word of it to leak out to the outside world and alarm people. The question then naturally becomes, why would you do something like that? Why would you order people not to talk about this virus? And it's difficult to say exactly what the motives were behind that order. From all indications from the way they behaved in early January, they seem to be really treating this as a slow-moving virus.
Doctors were now dealing with more and more people turning up sick in Wuhan's hospitals. Health workers have been forbidden from talking to the international media without authorization, but one agreed to speak. This is the first time a health worker from Wuhan Central Hospital has talked to international journalists about what was happening in those early days of the outbreak. We are protecting the person's identity and using an actor's voice.
I began to suspect there was human-to-human transmission around the 5th or 7th January. There were so many people who had a fever. The respiratory department became full around the 9th or 10th January. I realized this thing had become big. It was out of control. Then we started to panic.
But on state television, a representative of the government team investigating the outbreak maintained it was a viral pneumonia.
现在我们看到的情况，总体来讲还是可控。那么大部分的病人还是相对来讲比较轻，而且有部分病人已经出院了。当然不排除个别的病人会比较重，因为每年的肺炎啊，实际上都会有非常严重的病人。
The
Everyone knew it was human-to-human transmission. Even a fool would know. So why say there is no human transmission? This made us very confused, and very angry. The hospital told us that we were not allowed to speak to anyone. They wouldn't even let us wear masks. They say they were afraid of causing panic. I thought the leaders were stupid.
Around Wuhan, doctors and nurses began getting sick, a sign of human-to-human transmission. Some health workers later told Chinese media they tried voicing concerns to the authorities, but local and provincial officials ignored them.
I think the main concern is that what if this is a false alarm, right? And if there's chaos, instability, and people panic, then they would look bad in the eyes of the central leaders. That is not good for their personal careers.
On January 6th, city and provincial officials began 12 days of annual political meetings in Wuhan.
There are indications that Wuhan city officials did not want information about this outbreak to really spread because, they really want things to go as smoothly as possible to make themselves look good. There also could have been an order from the top down where they were saying, basically, get this under control, but don't tell anyone because we don't want to alarm anyone. It's very possible that there was kind of a systemic failure. It's a perfect storm of multiple failures happening at the same time in different parts of the government bureaucracy.
We asked the local and provincial governments for comment, but did not receive a response. The Chinese central government insists it took the most comprehensive, rigorous, and thorough measures, and that by the 7th of January, Xi Jinping had issued epidemic response instructions. Though the details of those instructions have not been made public. As the virus continued to spread, the world outside Wuhan largely remained in the dark about what was going on.
I reported the first story, which was on January 6th. The two people I spoke to in Wuhan who were sick told me, oh, we're fine, no one in our family is sick. And so I thought, oh, okay, it's probably some, pneumonia-like illness that's not going to sweep around the world. I also spoke to a couple of experts. They also thought that it was not going to be that significant. Health workers were not getting sick, and no one had died at that point. I believed that the Chinese government would not think of covering up the way they did during SARS, and that if the hospitals were overwhelmed, there would be no way to cover that up. I do wonder whether my first report, conditioned people to think that this was not such a big deal after all.